Welcome to another session of Close Calls with California Poison Control System. I'm Dr. Race Vora with the Fresno Madera Division of California Poison Control, joined by my co-host, Dr. Sai Rangan, also with California Poison Control. Our featured experts today are Dr. Ray Ho, Managing Director with the San Francisco Division of our California Poison Control System, and Dr. Stephen Petru, who's an emergency medicine specialist at UCSF and also a fellow in toxicology with the San Francisco Division of California Poison Control. Welcome, everyone. Thank you so much for joining us this afternoon.
Thank you.
Thanks for having us.
Thank you.
Today, I'd really love to get into this very quickly because there's so much to talk about, is this medication called Semaglutide. It's being used for diabetes and weight loss. And we'll start with Stephen. Tell us about what this class of drugs is and why it seems to be such an innovation for medicine.
Well, there's a really interesting history behind these drugs, and they're called glucagon-like peptide analogs or drugs. And this is something that we actually produce in our bodies on our own. When I eat a meal or I have an oral glucose load, I release this molecule, and it's responsible for making sure that the sugars that I eat are utilized correctly. And interestingly, they're very short acting, so they don't last very long when we produce them. And so pharmaceutical companies got into tune with this and thought, maybe I can make a very similar or the same molecule that's a little bit longer acting and have the same effect. And I think it was back in the 80s that they were investigating the saliva of certain reptiles and other creatures. And they actually isolated one of these compounds from the Gila monster, which we'll have a picture here for you guys if you haven't seen. It's a beautiful creature. And from the saliva of this, they were able to create some of these drugs. Most notably, exenatide was from this one. And the one we're talking about today is semaglutide. And that's another GLP-1 or glucagon-like peptide molecule. And what it's responsible for is regulating my blood sugar. And it also has an effect of decreasing appetite or satiety and gut motility.
So Steve, could you talk a little bit about the different formulations and preparations that we have for semaglutide and the differences between the oral formulations and the injectables?
Sure. In 2017, semaglutide was first approved, the pharmaceutical company Novo Nordisk, and that was called Ozempic. And that was an
subcutaneous injection.
And that was really only approved for diabetes patients with type 2 diabetes. And later in 2019, Rybelsus was approved, and that was an oral formulation or a pill. And I think people started to discover that although this was beneficial for diabetes and it worked great, there was also a side effect that to some was desirable, which was weight loss and appetite suppression. And so people may have started using this for those indications and not necessarily for the diabetes. Later in 2021, the pharmaceutical company created Wegovy, which again, all three of these are semaglutide, but the Wegovy is also an injectable once weekly. And this was finally FDA approved for weight loss on itself. So not necessarily, you don't have to have diabetes to get an approval for this medication for Wegovy. Now, it's important to note that the three different formulations they differ in the mode of administration. So the first one, Ozempic, is
subcutaneous.
It has a dose counter, a dose selector, a dose pointer, and a dose button. So the patients are responsible for regulating the dose themselves. Rybelsus is an oral pill that you take once a day. And Wegovy is also an injector, but it's a color coordinated, it's a single dose, and it's a one-time use. When you use it, you throw it away and you're done.
That's great. Thanks, Steve, for walking us through all the different formulations and products that are out there. You talked about weight loss as being one of the common side effects. What are some of the other ones, maybe not as desirable, and which seem to be causing the problem we hear about at Poison Control?
So I think the number one side effect that we see is stomach upset. So that could be the form of feeling a little bit of pain or discomfort, and that can also extend to vomiting and just not feeling well. Now that's seen with therapeutic dosing, so someone who's just on the medication. And usually that goes away with some time. And remember, patients are expected to titrate their dose slowly with their physician to make sure that these side effects are minimal. Now, in overdose, I think we can expect to see, or we do see, kind of more pronounced of these GI or stomach symptoms, and people with basically what we call uncontrollable vomiting. And that can also extend into something what we call hypoglycemia or low blood sugar, which these medications are responsible for doing, especially with diabetics. And symptoms of low blood sugar or hypoglycemia can range from feeling unwell, having perspiration or sweating, and all the way to confusion and a coma if the blood sugar is low enough. And so that's what we really want to watch out for.
So, Ray, when you, in your experience managing a poison control center, what kinds of calls are we getting on the poison hotline? Is it people who are taking deliberately high doses because they want to enhance their weight loss? Or is it more because of dosing errors? Or is it a little bit of both? And what kinds of symptoms are they reporting?
Yes, yes, and yes. Before 2021, we rarely get calls about this drug, less than 50 calls per year, and usually from patients who are diabetic, who may misuse, grab this instead of the insulin, injecting the cells again, sort of a double dose situation. But in 2023, and especially with semaglutide, we've gotten almost 350 plus calls this whole in all of 2023. And these are not just simple double doses. These are missed doses due to intentionally injecting more drug or using it daily instead of a week, per week dosing. There's also not understanding the dose correctly from using a compounded type of medication, which often may have higher concentration of the drug and difficulty figuring out what dose a patient should be using. So we also got calls regarding counterfeit type products, and that's also concerning.
So clearly, people should not be making changes to their dosing at home without consulting their medical provider first.
Exactly. It's important to really figure out what dose you should be on before taking this medication.
That's great to know. Just so that our viewers can understand who needs to go into the emergency department right away. What are the kinds of real concerning symptoms that we want to warn viewers about, that if they're experiencing them, that really represents an emergency? How would you answer that question, Ray?
Yeah. So, from a lot of our calls, patients are always having vomiting and nausea for more than 24 hours in a scenario where they can't even keep any food down. Also, sometimes they develop, feeling lethargic, shaky, the whole concern of low blood sugar. Those are the scenarios where you should seek help.
That's great to know. We've already talked a little bit about counterfeit formulations, but I wanted to loop back and ask Steve, there's been some alarming reports that we're seeing, especially compounding pharmacies and other agencies, maybe distributing counterfeit formulations. Why is that so dangerous, and what sorts of complications can those cause?
So the FDA released a report in December of 2023 saying that they basically had seized some of these medications that were counterfeit, meaning that they weren't regulated by pharmaceutical companies, and it certainly wasn't being prescribed to patients who were supposed to be taking them. And that wasn't just the medication, it was the needles, which are dangerous in of itself. We don't know the sterility of this, et cetera. But any counterfeit medication is not truly regulated. So you don't really know what you're going to be getting, and not necessarily even the dose. So those symptoms that we discussed could even be more pronounced, whether that's the vomiting or the signs of the low blood sugar. And so I want to emphasize what Ray is saying, that those should be avoided at all costs. You should only be taking this medication if it's prescribed to you. Do not up-titrate your own dose without speaking to your physician first. And if this isn't prescribed to you, I would really be very cautious about taking it. I would not advise taking it at all without speaking to your physician first. If you do experience symptoms, you do need to be checked out, especially if you're not prescribed this.
Great information. Yeah, thank you for sharing all of this great information about semaglutide, which is now being used for diabetes and weight loss in all of the different formulations. Lots of good safety tips there on our screen. And we just want to remind viewers that our toll-free confidential hotline works in all 50 states. California Poison Control is here to serve the state of California, but it's the same number, 1-800-222-1222. We have pharmacologists, pharmacists, toxicologists, and emergency medicine experts ready to stand by and answer all of your questions about semaglutide and any other medications that you might be having problems with or questions about. So please reach out and give us a call. Thanks so much for joining us on another session of Close Calls. I want to thank my co-host, Dr. Rangan, and our featured experts, Dr. Ho and Dr. Petru, for a really informative session. And we hope everyone has a safe and pleasant afternoon. Thank you.